Tell us a little about your biotech career.
I am Cary Austin, and I work at Genentech in industry, and I've actually been there since 2001 as a postdoc. But maybe I'll start with how I got into it. So I'm an MD PhD trained pathologist, and when I joined or when I first started medical school, the whole interest I had was in combining a science career with a medical career in some way. And by the time I finished the program and got into anatomic pathology residency, I was still wanting to do that at the end of the residency. So I ended up doing a postdoc after the residency, and this was at Stanford. And it just so happened that the lab that I did my postdoc in, that PI got recruited to Genentech to be the VP of research, and offered anyone in the lab who wanted to continue their postdoc, they could finish it up there, still work on their Stanford project. And at the time, I was doing an autopsy fellowship at Stanford as well, tail end of my residency. And I decided to try it after hearing what some of the other postdocs were saying about the experience there. I thought I would have a pretty productive experience there. And so I basically finished my postdoc at Genentech, and it took about 6 months to a year before the project I was working on looked like it wasn't going anywhere. And I started to get really interested in some of the scientific questions that were being addressed at Genentech. And basically by the end of my postdoc, I was sort of hooked. I wanted to stay in that environment as a research pathologist, and ended up working there. And one thing that really attracted me to it was getting involved in a project that was sort of a high priority for the company at the time, and joining a team where a lot of different people with different experiences and different expertise were all meeting every week and providing new data that was sort of moving this program ahead. And I really saw the power of if something is a high enough priority and gets enough resources and attention, how fast something could move. Because you do have that same kind of collaboration in academia, but if you want to collaborate with an electron microscopist, for instance, it might be somebody halfway around the world, because they're the ones who are interested in the same biology you're interested in. By its nature, people working in industry are all interested in the same biology. They're all interested in a particular project that they're all working on together, and they all bring different expertise. So things can move really, really quickly that way, and it really was an exciting environment to be in. So I joined as a research pathologist in 2005, and I've been there ever since, basically supporting immunology and infectious disease programs in early stage research, and then in later development. And maybe just a bit about what we do. So as research pathologists, we are basically providing pathology expertise and pathology capability as scientific collaborators on team-based science projects that range from early stage research, when a new pathway might be being explored for potential for therapeutic targeting, all the way to late stage clinical trials, where there's a particular candidate drug, and it's being tested, and maybe the final tests before it's going to become an actual medicine. And each pathologist in our department basically works on a number of different projects across that spectrum. And each of the project teams are focused on a particular therapeutic hypothesis. So, in a daily job for me will be probably interfacing with several different projects, and bringing the tissue-based science to that project, and bringing my expertise as a research pathologist. So that's sort of in a nutshell what we do and how I got there.
Why do you think more people in pathology don't explore industry careers?
It's not a traditional career for sure. I didn't know anything about it when, I was pretty committed to a research career, and the examples that I saw as a resident were academic pathologists working in research institutions and having some clinical responsibility and having research labs and kind of thought that was the model for how you combine research and pathology into a career, and didn't really know anything about the industry work. Once I came here, I started to learn more about it, and there is sort of a traditional role for pathology in industry that spans back decades, and that is in safety assessment. But the department that I work in, the history of that department was really aimed at bringing pathology expertise and capability to an earlier stage of drug development, to the research stage when really the therapeutic hypothesis is being generated and all the early work is being done to really ask the questions in tissue earlier before it gets to development, before you have a specific drug candidate. So, basically once I got here, I realized there was that role, and it's something that I think is not very transparent to a lot of people, because you can't really go to a website and just read about it or see what people are doing, because a lot of what people are doing involves intellectual property, so they can't release all information that as they can on academic sites. So if you go to PubMed, you could see research papers that come out of different organizations like ours, and see that there is a lot of like academic science that's being done, but it's just not something that is first and foremost in people's minds, I think, when they're getting trained.
What's your favorite part of your work?
I think probably the favorite part of my work is that I get to participate in basically innovation and trying to address big unmet medical needs for patients. And it's easy to get up in the morning knowing that you're working on something that, if it's productive and if it's fruitful, it's going to impact patient lives, and that's really exciting. And in so doing, I get to work with some of the most brilliant people that I've ever met, and the people that I work with here come from academia themselves, and there's just a lot of really bright people. It's a collaborative environment, so we're always doing things in a team-based approach. So that's a little different than my experiences in academia, where you're really defining your turf and building your own projects. And a lot of the work here really does require a lot of people, so and a lot of input and collaboration. So collaboration is important, but it also really energizes. It's never a dull moment, basically, in a day work there. So that's probably my favorite thing. I guess one other thing I would add is I get to combine all of my training to do this work. So meaning my medical school training, my research training, my anatomic pathology training, and then the experience that I've built up over the years working in industry in this role. And basically every week something happens where I'm drawing from one of those experiences to contribute or to help move something forward, or to provide some perspective or insight that I otherwise wouldn't have gotten. So I kind of feel like all that training was not wasted in this role.
How do you help spread the word about biotech and industry?
So interestingly, I'm a member of ASIP, American Society of Investigative Pathology, and they have these scientific interest groups. And together with Sean O'Neill, a pathologist at Pfizer, we basically started up a new scientific interest group focused on pathology and industry. And one of our first things that we did is we did a virtual career-based panelist discussion back in November, where we had 9 pathologists from industry. Some of those were ex-colleagues of mine or Sean's, and just giving a very brief, like, how we got into it, what we do, what our department does, for the benefit of ACIP members, which a lot of them are trainees, and it was fairly well attended. And then another thing that I've done in the past is I've visited residencies. I went to Stanford and gave a talk to the residents there, and some other colleagues of mine in my department have done that for other programs as well. So there are a number of different ways that we're doing that. We actually are also having a scientific session for ACIP at the upcoming experimental biology conference, EB 2022, that's in Philadelphia in April. And our scientific interest group is actually sponsoring a symposium. There's going to be 5 pathologist investigators from industry, each giving a 25 to 30 minute talk on project work that they're doing. So I think that will give attendees a really good sense of some of the things that are going on in industry pathology departments, and hopefully it's something we can grow and build and grow and build this scientific interest group over time.
What one key thing would you like to share about what you do?
I'd like them to know that there are really interesting career opportunities for research trained pathologists, and also for pathology core lab staff. We have excellent pathology core labs, and a lot of folks there came from hospital core labs before coming here. And it's really interesting work. It's fun work, and it's something to consider. And I suggest you get a little more familiar with it if you're interested. And one way to do that would be to join ACIP and join our SIG, our scientific interest group. And basically that's a mechanism to get looped in when we have new career-based events that we're going to hold, or a scientific symposium or something that you might want to attend. And if you're so inclined, come to EB 2022 in April and check out our symposium, and we'd be glad to meet you.